Welcome to Montana Matters. We're joined by Christy Beals. She is the Chief Nursing Officer at Rimrock, and it's so great to have you back on the show today.
Thank you, Diane.
Yeah, so Rimrock is helping a lot of folks in our community. We want to thank you for all the great work that you're doing. We're talking today about medication-assisted treatment. What is that?
So medication-assisted treatment is a treatment option for some of our clients who struggle with long-term substance use disorder. And a lot of people think they come in for treatment and it's one and done. It's an individualized approach that combines both medications with counseling and behavioral therapies.
Okay, very good. And who would be a good candidate for MAT?
So good candidates, we determine when they come in for detox or inpatient services if they'd be a good candidate for the program based on their previous use patterns, their relapse potential. We work with both patients who are in services, but also clients who've maybe gone through services and left. We work with the local treatment courts, and sometimes they refer clients to us, or just patients who have had long-term issues in maintaining their sobriety.
Okay, that makes sense. And what are some of the medications used?
So we use a couple of different medications. MAT is primarily used for patients who suffer from opioid or alcohol disorder. Okay. And so we use different medications for their different needs. It's individually focused. Common medications are buprenorphine, commonly known as Subutex, Suboxone, or an injectable form is Sublocade. And that medication really decreases the cravings for opioids, and opioids could be heroin or prescription painkillers that have an opioid in it. We also use naltrexone, which is an oral medication. Naltrexone actually blocks the effects of the drugs, and so naltrexone can be an oral medication, or for long-term use we can actually do a monthly injection, and that's called Vivitrol. And we also use a couple of other medications for alcohol use disorder, one of those being Antabuse. And what happens when you take Antabuse is it actually makes you violently ill if you use.
Oh, wow.
And so that's why it's really important that we have individualized care based on what those patients are needing and helping them with long-term recovery.
Okay, so a lot of different options, and
yes,
it really is helping people who are needing this. So what are the long-term effects of MAT?
So the long-term effects are, we're really helping people who've struggled with long-term substance use disorder. And when you have a substance use disorder, it really prevents your ability to be employed and stay employed. Sometimes it affects your ability to have a healthy family relationship. It affects your choices, and so we see high illegal activities. And so the long-term effects are, we're creating healthy people who have healthy families who ultimately create a healthy community. And so it's really trying to meet people where they're at for this chronic illness.
Okay, and we know that Rimrock does a great job with your services. What are some of the benefits of going to Rimrock to receive MAT treatment?
I think it's important to realize that MAT is not just the medication, it's all the services for the patients that we offer. So Rimrock offers all those services. So we have the inpatient program, we have outpatient services, we have individualized counseling, and we have an incredible psychiatric team that can help these patients long term.
Okay, and what are the families and the people who you've helped, what are they saying about this?
We're saving their lives.
Yeah.
Ultimately, we are keeping them healthy and happy, finding joy in daily living. We're keeping them employed. We're allowing moms and dads to be parents and good neighbors. And we're decreasing overdose, which has become something, unfortunately, that's on the rise in our community.
Great. All right, well, Christy, thank you so much for all the information.
Thank you.
Yeah, if you'd like to know more information, please visit their website or give them a phone call.